Hi, everyone. Good morning and welcome to our webinar. Before we begin, I would like to thank everyone for taking time to attend. Your presence today shows your commitment to your health and well being. I am Joanna Marie Reyes, and I will be your host for today's session, The Science of Strong Bones Innovation in Osteoporosis Prevention. Osteoporosis is called a silent disease because it can make your bones weak without showing any signs. Many people only notice it when problem happens. The good news is that with the right knowledge, healthy habits, and early checkups, you can prevent or manage it. Here's what we'll cover in today's session: why osteoporosis matters, what it is and who is at risk, early warning signs, prevention and lifestyle tips, medical innovation and DEXA scan, live Q&A and raffle draw. Today's session will give you simple steps to keep your bones healthy and maintain your independence. Now let's move on to introduce our esteemed speaker and moderator for this session. We are honored to have Dr. Luwai Taponi, consultant orthopedic surgeon at Prime Specialist Medical Center Sharjah. Dr. Luwai is a fellow of the Royal College of Surgeons in Glasgow, United Kingdom, and of the Iraqi Commission of Medical Specialization in Orthopedics and Fractures. He has over 30 years of experience, including leading orthopedic department at Al Zaid Hospital. He is also the cultural chairperson of the Emirates Osteoporosis Society and a recognized expert in osteoporosis, joint diseases, fractures, and complex orthopedic cases. Joining him is Dr. Asiya Nabi, General Practitioner and Assistant Medical Director of Prime Digital. Dr. Asiya specializes in chronic disease care, women's health, and preventive care. She is passionate about helping people understand their health and taking simple steps to stay strong and healthy. Good morning, Dr. Luai and Dr. Asiya. During
Good
the
morning.
during the webinar, you can type your questions in the chat box. All questions will be answered at the end during our Q&A discussion. And don't forget to stay until the end because we will have our raffle draw. So to start today's session, I am pleased to invite Dr. Luai to begin his presentation. Dr. Luai, good morning.
Good morning. Good morning, everyone.
Morning, everyone.
Today we'll speak about the silent disease, osteoporosis. This presentation is between Emirates Osteoporosis Society and the Prime Hospital. Both are celebrating the World Osteoporosis Day. So first we'll start, what is the definition of osteoporosis? It is defined as the disease in which the bone becomes fragile and more likely to break. The break usually occur in the hip, spine, and wrist. So when we say fragility fracture, it means the fracture caused by osteoporosis. And the most common, as we said, in the hip, what's called collision fracture, in the wrist collision fracture, in the hip there is fracture neck femur, and in the spine compression fractures of the vertebra. Osteoporosis data in UAE revealed that 60.8 have low bone mineral density, of whom 4.1 have severe osteoporosis, 36.7 have osteoporosis, and 59.2 have osteopenia. So a lot of osteoporosis cases, and what happened in the bone, the number of units in the bone decrease, make the bone weaker.
Doctor, if you don't mind, go back to the previous slide. I would like to ask a question there for our audience to know. So if you can explain the difference between osteoporosis and osteopenia from this picture, that will be helpful.
In the normal bone, there is, for example, there is a lot of units here. When this unit decrease, for example, it is 100 unit. When it becomes 70 or 60, it is called osteopenia, for example. It means the bone weak, but not liable to fracture as in osteoporosis. When the number of units decrease to 20 or 30, here there is no bone unit. The bone is fragile and liable to fracture. So in this case, we have osteoporosis, called osteoporosis.
And why does this go? Like, why do we get into osteoporosis anyhow throughout our age?
Because osteoporosis, as we said, is the silent disease. Silent disease, it will not diagnose unless most of the cases unless the fracture happens. So our aim is early detection of osteoporosis, early treatment of osteoporosis to prevent the fracture.
So
And
this is the picture of the bone on your screen, audience. And if you see that this is the matrix, how does your bone look like on the right hand side when it is normal, and when we lose the bone density, how does it look like and makes it more to fall for fractures is osteoporosis. Right.
okay, so we say, how frequently, what do you think osteoporosis fracture occur worldwide? It is occur once every 10 seconds, once every 8 seconds, once every 5 seconds, or once every 3 seconds. I want your opinion.
We want everyone to answer in the chat box how frequently they think that the fracture is happening. For example, wherever you are in the office, school, hospital, or at home, people around you, how frequent do you think these fractures are happening? Does it happen every 10 seconds, 5 seconds, 8 seconds, or 3 seconds? Just write some of the answers in your comment box. Give it a thought. We're waiting for your answers. Mr. Anil is writing, yeah, so he said 3 seconds. Uh, okay, C, 5 seconds. Mm, 3 seconds. Miss Arabi is saying 3 seconds. Okay, so we have some answers. So let us know from doctor what is the real answer. But thank you for participating. Yes, doctor.
So every 3 seconds, there will be worldwide osteoporosis fracture occur. Every 3 seconds. So remember, when we say 1, 2, 3, fracture happen. 1, 2, 3, fracture happen. So it is big percentage of fractures. And as we said, it is a silent epidemic. 1 in 3 women aged more than 50 years will experience an osteoporosis fracture. It is estimated to affect 200 million women worldwide. But it also happens in men, although the percentage is less. And the life risk of osteoporosis fracture in men aged more than 50 years is 27% higher than the risk of prostate cancer. The problem in osteoporosis, it is common but often undiagnosed, and if diagnosed, untreated properly, and patient may be more concerned about other disease. We see this slide, we have 200 million women with osteoporosis. In 5 of them will receive a diagnosis of osteoporosis. So the fifth only will receive diagnosis of osteoporosis. From those people, this is a woman, 1 in 3 will receive treatment for osteoporosis. And from this also less percentage, less than 50% will persist with treatment beyond 6 months, because the osteoporosis treatment, for me, I think it is as treatment of hypertension. You should take it or life with many medications. So less than 50% will persist treatment within 6 months. And the people are more concerned about cancer, heart disease, Alzheimer's disease, diabetes than of osteoporosis, although the risk is more in osteoporosis.
Doctor, what can be done to increase the awareness like we are doing today's session? And we can see that even if 200 million are already affected with osteoporosis, every 3 seconds fractures are happening. What do you think is the gap? And how we, as an organization or people outside, can reduce the gap and bring more people for early detection and treatment?
Of course, there should be awareness. Awareness campaign will help us, and we see now in UAE sometimes in malls, sometimes in some occasions they bring this portable machine for DEXA, for example. So the people will have an idea about if they have osteoporosis or not. The second thing, we should encourage people to check for osteoporosis, not because they will have a fracture, because we want them to prevent having a fracture. Osteoporosis is a treatable disease. If we diagnose it early, we can treat it early, we can get rid of the risk of fracture. So
So,
The
doctor, like
orientation.
for example, people who are obese or they have family history of heart disease, they know, okay, they are at risk of diabetes or heart disease anytime in their life, right? Similarly, for osteoporosis, with or without risk factors, are we all going to get into osteoporosis at certain age of our life? Is this happening to almost every person living on this earth that they go through the process, aging process, and they are at risk? Or there are only some people who are at risk and some people uh, can take it okay lightly?
Not all the people, because it depends on your bone stock, on your activity, on your lifestyle, and of course in hormonal. So not all the people. But what I speak about the risk of osteoporosis, you see this slide, the lifetime risk of fragility fracture is higher than the life risk of breast cancer, stroke, myocardial infarction, higher than all these risks. But as we said, people are more concerned about these diseases.
Right.
Now we speak about the type of bones. We have two type of bone. We have cortical compact bones, which is usually the diaphysis of the bone, and we have the spongy bone. The spongy bone, it forms the greater part of the vertebra and the epiphyseal region. The spongy bone is the weak area because it has large surface area. These are more liable to fracture. By the way, the bone is a living tissue. It's constantly being broken down and rebuilt in a process called remodeling. So the bone is renewed like hair, the skin, and nails. So simple idea about the bone is dynamic. The bone formation, usually what's called osteoblasts or the building cells in bone, it is every 3 to 4 hours, months. Bone destruction resorption, this is the destroying, called by osteoclast, this is the destroying cells. It removes the blood, the bone cells. Is happen every 10 to 14 days. A normal bone remodeling cycle in adult is 4 to 6 months. So all spongy bone in our body are replaced every 3 to 4 years, and the compact bone being replaced every 10 years. So what happened for our bone during growth? From up to 20%, the bone formation is more than the bone resorption. As we said, in the normal cycle of the bone, there will be bone formation and then bone resorption, then a new bone will form like this. When the bone formation is more than the bone resorption, the bone become stronger. So up to 20 years, the bone are growing and become stronger. Between 20 to 50 years, the bone formation equal to bone resorption. So the mechanism is the same, bone formation, but in this age, if we have a healthy diet, a good exercise, uh, diet rich in calcium and vitamin D, we will have a good bone stock. This bone stock will help us when we become 50 and more, because 50 and more, the bone formation is less than the bone resorption. So it means less new bone form, and the bone will become weaker. But if we have a good stock of bone during our these years, if we take, as we said, medication, healthy diet, it will help us when we become above 50.
So I would like to clear here. So you mean to say bone is like a saving account? As much as you have the best nutrition, exercise, diet in life before 50, you can encash it after 50 more, to be
Yes,
precise.
yes,
So, all of you who are here, the bone issue or osteoporosis issue, if you want to prevent, you have to take first 50 years very seriously and then encash the credits later. And that can really save us from a lot of things. Thank you, doctor, for clearing that.
thank you. Osteoporosis usually in women, but also it happens in men. It begins in both at their 40, but in women, because of the hormone changes, there will be rapid loss of bone mass for 5 to 10 years after menopause. The bone loss in men remain linear as slow as the sex steroid production progressively decline. The problem in the women that they have small bone cortices and diameters from the growth plate, especially during puberty, while the men have larger bone cortices. So the smaller bone cortices are more liable to osteoporosis and more liable to fracture. There is We speak now about other risk factors apart from male or female. There is the lack of exercise, obesity, medication. So, for example, once we have pain in the stomach, we take proton pump inhibitor and we continue on it. This proton pump inhibitor is predictable for osteoporosis. Some people are using heparin, steroid. All these are affecting a risk factor for osteoporosis. Of course, the aging also affect diabetes affect, but probably mostly alcohol consumption and smoking is a great risk factor for osteoporosis with deficient in a healthy diet.
Doctor, why alcohol and smoking has the highest risk on the bone production?
Usually, the alcohol and the smoking both they decrease the action of osteoblast, the bone building, and in the other side, they increase the action of osteoclast, the bone destroyer. So when the destruction more than bone formation become more, the bone become more weak. Smoking also, the nicotine will increase the cortisol level. When the cortisol level increases, the chance of osteoporosis will be more. So we have to stop the smoking and alcohol consumption.
Doctor, one more thing. We have already one question from Ms. Jemmy on the same slide. I can take it here. Ms. Jemmy is asking, though Ms. Joanna has made it clear to take it in the end, but this question is relevant for this slide. Ms. Jemmy is asking why women has a higher risk to have osteoporosis than men when she is moving more than any man in terms of physical activities. When women are doing a lot of household activities, she is more active. In today's life, she is definitely more active from in home and outside also. Why still she has higher risk of osteoporosis than men?
The hormonal balance is more the estrogen is the main effect cause for osteoporosis. After menopause, the estrogen decrease. So that estrogen is important for the bone health. So they are more liable for osteoporosis. And as we said, the small cortices also, the diameter of the bone is less, so more liable to fracture. But the most important thing is hormonal. So we osteoporosis, it is what we call postmenopausal woman liable for osteoporosis.
So, doctor, if some woman has early menopause, generally the menopause age is 50 up to 55 maximum, and if it is 45, some women attain menopause very early. In that case, should we go for early scans or doctor's advice on bones?
Sure. Once we have early menopause, we have to scan it. But before menopause, I don't prefer to scan for osteoporosis because even the patient have osteoporosis, we can treat before menopause, we can give her only calcium and vitamin D. But after menopause, we can give her a lot of medication for osteoporosis. Is it
Sure.
clear?
Yeah. Please go ahead, doctor.
What about the risk factors? There is uncontrollable risk factors. It is being aged more than 50, female, menopause, family history of osteoporosis. Family history is very important. If the mother and the grandmother have osteoporosis, the patient should check for osteoporosis. And of course, as we said, low bone body weight, become thin and small, broken bones or height loss. By the way, most of the diseases are becoming in obese people, but in osteoporosis, not obese, in high, yes, obese people, but in osteoporosis, even in non-obese people, it happens. And so we have to live an active lifestyle. We have to maintain a healthy weight, diet rich in calcium and vitamin D, We have to eat plenty of fruit and vegetables and monitor protein, sodium, and caffeine intake.
Slide is very important for all the people to understand what is in your hand, what is not in your hand, but you need to take care of both the things. You need to
Yes.
have answer for each and everything. It's not only about diabetes, high blood pressure, or cholesterol. We sometimes because we I work as a general practitioner, and mostly youngsters are there, but they really don't have an eye on what is happening on after 50s. So vitamin D do matters, as doctor rightly said. Vitamin C sometimes, I mean, calcium also do matter. We need to take advice, and we don't need to take self medications. It's a proper medication what we need to follow, what doctor is going to explain in upcoming slides. Thank you, doctor.
Thank you. So the definition of osteoporosis is called a skeletal disorder characterized by compromised bone strength, predisposing a person to increased risk of a fracture. So what happens in osteoporosis? This is the normal bone. So suppose you have a wall. The wall consists of 100 bricks. If you press this wall, it is strong. It will not break. But if this wall consists of 20 or 30 bricks, here the number of units decrease in osteoporosis. When the number of units decrease, the bone becomes fragile, and either this wall will become liable to fracture. So what happens in osteoporosis? The number of units in the bone decrease. The bone become weaker and liable to fracture. We see in this slide, this is the vertebra, normal and osteoporotic vertebra. So when the number of units decrease, this vertebra is more liable to fracture because it is weak vertebra. Also, the fractures happen in the hip, as we said, in the hip, spine, and the wrist. In the hip, we have a lot of fractures. This is a serious fracture affecting an old lady and need a major surgery for it. Sometimes when there is a fracture neck of the femur, we have to do a lot of operation, hemiarthroplasty or total hip replacement. So it is a super major surgery for an old lady. For this, our aim is to prevent osteoporosis rather than treatment of osteoporosis fractures. So what is the scenario? The scenario that what happened in osteoporosis, that the grandmother at home, she fell down in the kitchen or fall down in the bath, she will have a fracture neck femur, fracture hip. All the family is concerned about her, will take care of her, and will take her to the hospital. In the hospital, the emergency, the AE doctor, the orthopedic, the general surgeon, the medical doctors, the anesthetists, all they take care of her. Then they took her to the OT. They will do for a surgery. But what the statistics said? Statistics said that 20% of these patients with hip fracture in female and 36% of male with hip fracture will die within the first year if you operate or not. So it is a big loss for the community, a big loss for because of hip fracture. And 30% will have permanent disability. They are 40% are unable to walk. And when you see this lady, old lady, are unable to walk independently, she will, or she is afraid from walking because she thinks she will fall. She will stay no movement, will have DVT, pulmonary embolism, pneumonia, a lot of complication. And 80% of them will unable to carry out at least one independent activity of daily living. So a lot of complication for this hip fracture. We can prevent it if we diagnose osteoporosis early. Here is the vertebra. This is compression fracture of the vertebra. It is major fracture, and for this, sometimes there will be something called microfracture, will not appear in the X-ray directly, but sometimes this major fracture. So we have a slide which shows you that the lady, once she becomes older, she becomes shorter because of the microfracture or the fractures in the vertebra. There is another fracture called collis fracture. Here in the prime, in the casualty of prime, always, most of the cases come with fracture of the wrist. This is the most common fracture in old patient, and it caused by osteoporosis. And as we see in
And
this
doctor, I
slide,
would like to stop you here. If you go back to on the previous slide, so what happens is why this fracture is also like what I have seen in my practice. A lady is trying to get up and put pressure on the hand, and the fracture happens because bones are so fragile, as doctor already mentioned multiple times. The moment you put your hand on a table or you try to support to get up, the fracture can happen that easily, right, doctor? Give us
yes,
some more examples about all these fractures, like the first picture where most likely a woman fall and she had hip fracture, a slight fall, just a slip, and then the second one and was a major surgery, and the second one was about the upper back. Why does this happen, doctor, when there is no pressure? Why does this happen in women more, since there are no symptoms and this happens suddenly? In the upper part of the back or the lower part of the back, these fractures happen. Can give us some case scenarios, any patients who has come with this, what was the history? How did this happen?
there's something called microfracture. It happens gradually, but when there is simple trauma, she fell down on the ground, something, and there is pressure on the spine. The bone is weak, especially when there's compression force on the spine. The bone is weak, and this weak bone will liable to fracture. So the scenario is weak bone with a minor force, it will break. If the bone is strong, it will not break, but the weakness of the bone will lead to these fractures.
Any body part can lead into fractures, but these are most common what we see in the OPDs. And these are very difficult operations as well. So we can prevent something very early before 50. I would like to remind every audience here, those who have joined late. So what doctor mentioned till now is that our bones are like saving accounts. The more you try to preserve with the help of exercise, vitamins, calciums, appropriate calciums, not on your own, as recommended by the doctors, and cash it after 50s in a better possible way. So our bones is like a saving account. The more you nurture it before 50, the more you will have returns after 50. Yes, doctor, please proceed.
It is not a matter only of a fracture. It is a matter, for example, the hip fracture is very risky fracture because this
Very
lady will, for example, will have a major surgery with this age. So it is also, she will suffer a lot, and there is a lot of cost for this. We can prevent this by simple treatment, by simple DEXA scan and simple treatment of osteoporosis. So for this, we should concentrate on prevention of osteoporosis rather than management of the complication, unless till the complication happens. Our aim is early diagnosis of osteoporosis before the fracture happens. And when the fracture happens, we should not only fix the fracture, we should treat osteoporosis. Because this patient with a spinal fracture, for example, this patient with a spinal fracture, if we don't treat her, there will be 6% chance of another fracture after a few months. So we should not only diagnose, but we should treat osteoporosis when the fracture happens. Okay. Now we'll speak about diagnosis and osteoporosis diagnosis and treatment. In 2022, the Emirate Osteoporosis Society launched the guidelines for osteoporosis management in UAE. Now we have guidelines for osteoporosis treatment, and these guidelines are approved by DHA and the insurance companies. It helps us to guide us to how to treat osteoporosis. What are the screening methods for osteoporosis? Usually we have the dual energy X-ray absorptiometry, DEXA scan. This is the preferred one. We have ultrasound densitometry that you speak about, Dr. Asia, check the density of the calcaneum or the ankle bones. We have VFA, vertebral fracture assessment, TBS, FRAX, and quantitative CT scan and bone markers. But the most common used here is DEXA scan. It is a quick, painless bone satellite test, 5 minutes, no needles. And the good thing is this test is available in a prime hospital and most of the medical centers with a reasonable cost also. It measures the bone mineral density, and it is best predictor for a fracture risk. In this DEXA scan, we have something called T-score. We have measurement and T-score. Usually we use T-score for the old patient and Z-score for young patients. Because as we know that usually the fracture osteoporosis happen in old age, but it can happen also in small age people. For example, 20 or 30 years old with ulcerative colitis, Crohn's disease, asthma, on corticosteroid. These people are also liable to fracture, but this is secondary osteoporosis, not the primary, not the hormonal effect, because of this medication they have. So we have what is called T-score, and we have what is called Z-score. In the DEXA scan, the patient lie on examination table for approximately 5 minutes while the examination is performed. As we said, it's a quick, painless bone subtract test, less than about 5 minutes. And then we have these measures. This when there is bone normal up to red when there is bone osteoporosis. It measures the bone density. And in DEXA, we show the variation of bone. For example, when the DEXA scan is about 0 to -1, it is normal bone. The main bone is normal, okay. But when the bone become weakened, we called it osteopenia. It means the number of units decrease, but not to an extent of osteoporosis. This is DEXA scan here is between -1 to -2.5. And when the bone is osteoporotic, the DEXA scan -2.5 or less. So it means that when we have this study, this result, the bones are weaker and more liable to fracture. And this, as we say, these measurements between normal bone 0 to -1, osteopenia -1 to -2.5, and osteoporosis -2.5 to 4. And when the fracture happened, we call it severe osteoporosis. So the T-score will show us how much the person bone density differ from the average bone density of a healthy young white woman. The lower the T-score, the lower the bone mineral density and the higher the risk of a fracture. But when I have one note, if we have a patient with osteopenia -1 to -2.5, and she has a fracture, fragility fracture, do we treat her or not? I think the answer is yes, we have to treat the patient, even when it's osteopenia. So for this, the decision to take osteoporosis medication depend on the doctor experience and doctor opinion, not only on the study alone. There's another method for diagnosing osteoporosis.
Before we move to FRAX, can we go back to the DEXA? Yes. Now, for as a common question, that first of all, what age the DEXA is recommended?
DEXA is recommended in postmenopausal women.
Generally, if the menopause is at 45, how do you recommend the woman should do, or a woman at 55? Does the guideline changes for a woman menopause at 45 and menopause at 55?
I prefer, once the menopause stop, I prefer to do DEXA.
And what about men?
Because
please go ahead. Sorry, doctor, I cut you. Yeah.
The men usually at 60 and more, osteoporosis happen because of the testosterone level and something like this. So the problem that in DEXA, we speak about DEXA. Some patients are afraid to do DEXA because I might have osteoporosis, I might have disease. DEXA is, I think the patient should encourage to do DEXA because if we diagnose osteoporosis, the patient becomes stronger. If we know that this patient have osteoporosis, we will give her medication, we treat her, she will have a better life for the next 20, 30 years. We will give her calcium, vitamin D, and osteoporosis medication, so she will become better. We should encourage people to do DEXA for this. Uh, and the problem that osteoporosis affecting the quality of life. Now in UAE and in the world, the people are living more. When the people living more, they should have a good quality of life. So what a quality of life if we are 70 or 80 and the patient is bedridden, cannot move, afraid from moving because he has a fracture and like this. So early detection of osteoporosis, early treatment of osteoporosis improve the quality of life of our people.
One more question, doctor. Okay, you talk about women. What about men? What is the general recommendation that at least they should meet the doctor or they should do self DEXA? Like if someone is a health enthusiastic and would like to screen on its own without going to the doctor, a male, when can he proceed with for DEXA and your advice?
Usually 60 and more. I will tell you a story. I have one patient, 70 years old man. He come with collision fracture.
And fracture, wrist
Yes,
fracture.
yes, wrist fracture. Yes, wrist fracture. I told him that we need to do DEXA. He said, because of osteoporosis, he said, no, no, osteoporosis for men. I am man. No, I tell him, just check it. Just check it. Uh, uh, and by the way, the DEXA showed osteoporosis. But when we treat this patient, we will make his bones stronger and he will prevent further fractures. So also it needs orientation of the people about the DEXA.
So, doctor, when you say that, okay, this man, luckily he got a treatment, how do you think that really treatment can stop the process of getting into worst osteoporosis, or it can reverse also the bone density in a better way?
There will be, after treatment, there will be improvement in the bone density, but and decrease the chance of a fracture. I don't say there is any treatment will stop the fracture, but it decreases the incidence of a fracture too much. As we
Okay.
said, the patient with the vertebral fracture, she will have 6 chance of having another fracture within a few months. But if we treat her, the chances decrease too much, and the bone becomes more strong.
More stronger. And are there any major side effects for giving treatment for osteoporosis other than the calcium and vitamins, what we're giving early when a person reaching 50s or 60s or higher risk, when we're giving such medicines, do they have more side effects per se?
There is no medication with outside effect, and there is also precaution when you prescribe a medication. So when my patient have osteoporosis, I discuss with her the line of treatment. There is a lot of medication, line of treatment if she has some disease like this or not. So discussion between the doctor and the patient about the best treatment of osteoporosis. Some treatment of osteoporosis are daily injection. The lady said, no, I don't want daily injection because we want the patient to accept to have to find a good solution so that she will continue on treatment. If she take medication for a short while, stop it, there will be chance of she has another fracture. So discussion between the doctor and the patient and the family, all the family also, family included in this, are a best method to have the proper medication for the patient. And
The two,
by the
I have two questions, Dr. Moore, before we move on to the next slide. One is, does this DEXA has any kind of radiation risk?
there's little radiation risk index, less than the X-ray, normal X-ray. Yes.
And is there a difference between DEXA to DEXA machine? What can show better, or people can do it at their convenience anywhere?
No, now there is model programs, as we tell you, there is VFS, TBS. These are programs are added to the DEXA scan to have a better results, a better estimation.
Okay,
Uh,
fine.
so
The
this
last
will help
question,
us.
sorry, one more question came to my mind. When we talk about screening programs and doing, screening DEXA on site, do you recommend them? Is that something we should continue and people should take it as at least the basic reliable screening test?
Which test you mean? You mean the
The DEXA on during screening camps, because we can't take big machines, we take portable DEXA machines to tell us the early thing. So how reliable is that to go with that?
The portable DEXA machine is giving us an idea about the patient. He has osteoporosis or not, but the proper result is the proper DEXA, which are available in the X-ray department.
Sure, doctor.
There is also another method called the FRAGS. It is online calibration for estimation for a fracture risk. And this form, it is now we have FRAGS UAE. It is a FRAGS for every most of the countries. We have FRAGS UAE, FRAGS India, FRAGS Jordan, FRAGS Egypt, FRAGS Iraq. And the doctor will fill the form with age, sex, weight, height, and if he has a previous fracture, we fill all the information. If he has currently smoking or taking corticosteroid, if he has risk of disc, then we will get the estimated risk for osteoporotic fracture. The DEXA is better need to be done before the fracture happens. So it gives us estimation. This patient is liable to fracture or not. So it is a very helpful tool for estimation of the fracture. So how to prevent osteoporosis? We have non-pharmacological prevention and treatment of osteoporosis. The prevention is by good nutrition, calcium and vitamin D, physical activity, lifestyle choices, avoid smoking and excessive alcohol use, full prevention program for the elderly. And the treatment, we have recommend appropriate physical therapy, identified and control secondary cause of osteoporosis, and ensure adequate calcium and vitamin D. So the healthy diet is very important for for us to have a good diet, a good bone stock. So we have to take adequate calcium and vitamin D, regular weight bearing and balanced exercise. We have to avoid tobacco use, limit alcohol consumption. We have to do measures to prevent fall at home for the old patient. We have to need a balanced diet. And calcium is important. Calcium is important for heart muscle, for nerve, for function, but it is important for the bone. Inadequate amount contribute to osteoporosis, and we have to take appropriate calcium intake should be between 1,000 and 1,300 milligram a day. Calcium and vitamin D. Vitamin D also is needed in your body to absorb calcium. It comes from two sources: the sun and fortified dairy products, egg yolk, salt water, fish, and liver. So we need about 400 to 800 international units a day. The most important is exercise. Exercising regularly in childhood and adolescence can help you to reach peak bone density. We need to participate in weight-bearing exercise, for example, walking, dancing, jogging, stair climbing, racket sport, and hiking. Exercise is very important. And for the elderly patient, we have to do a full prevention checklist. We have to check the glasses, correct prescription glasses. We check the factors that impair walking and balance, such as peripheral neuropathy, arthropathy. Check for postural hypotension and arrhythmia. Check for excessive use of tranquilizers, sedative, hypnotic, any factor that will lead the patient to sleep and have a fracture. So we need to do one non-sleeping floor, good lighting, handrail, no obstacle at bed. The primary goal is treating osteoporosis should be fracture prevention. So our aim is fracture prevention. We have to prevent the fracture, and the second thing, we have to treat the osteoporosis even after the fracture happened. There's a program called the Fracture Liaison Service. This program, I think it started in Dubai in some hospitals, and it started in Abu Dhabi. And now I think EHS are planning to have this program also. And I hope it will be also applied in prime hospitals. It's a simple program that when the patient come to the clinic, when patients come to fracture clinic, either simple fracture or we have fracture neck femur. The nurse will check. There is a nurse responsible for this. She will check the patient. The nurse with the treating doctor, she will check calcium, vitamin D level, and send the patient for DEXA. And then when we do DEXA, we discover that if the patient have osteoporosis or not. If has osteopenia, we cannot treat. If osteoporosis, we have to treat also so that it will prevent another fracture. This program will prevent another fractures. So in individual, more than 50 years of old age in summary, 1 in every 3 women and one in every 4 men will sustain osteoporotic fracture. Mortality rate increased by 21 to 36 after hip fracture. Non-pharmacological measures in the prevention and treatment of osteoporosis include nutrition, calcium, vitamin D, and physical activity. And here we use the FDA-approved medication for treatment of osteoporosis. And I'm happy that in prime pharmacies, we have the recent medication for osteoporosis in the world. The medication in osteoporosis is two types. One of them called anti-resorptive, it stops the resorption of the bone. So it stops the process of osteoporosis. And the other type is anabolic. What does mean anabolic? It means that we stop the osteoporosis and we build a new bone. So when the fracture happens, and I think anabolic is preferable. I will give you some idea about the medication. We have what's called biphosphonate. Biphosphonate are the form of tablet or injection. Some of them taken every week, some injection taken every year. And now we have something called denosonabopurolol injection. This is injection taken subcutaneously every 6 months. And we commonly use it for treatment of osteoporosis. But when the fracture happens, we need what is called anabolic medication. The anabolic, we have a lot of types of anabolic. We have 3 types now. We have one, what's called 40 or teriparatide is modified parathyroid hormone. This is a form of pin. The pin is enough for 1 month. Every day, the patient injects herself as in insulin. But the result is excellent because it built a new bone. Then we have the other medication called romosozumab Evenity. And always I speak one story that romosozumab Evenity, if they approved in USA in the end of 2019, at the end of 2020, it was approved in UAE also. It was approved in USA, FDA approved in 2019. In beginning of 2020, it was approved in UAE, and we use it a lot. This injection is a monthly injection, so it is easier than the other, and the patient should use it for 12 months. But if the patient finish this medication, do we continue or not? We have to continue. We have to return to the anti-resorptive medication. So when we use anabolic, we finish it. We have to continue with anti-resorptive. For me, a treatment of osteoporosis as a treatment of hypertension, as we have to take it all the life. And then we have a new medication now. It come recently to UAE called abaloparatide Timlos. It is also and same of injection, but daily injection, and it have also great anabolic activity. So these medications are approved for women. For the men, we can use biphosphonate and teriparatide. Not all the medications are approved for women, for men. And so now I want you to ask this question. Do you avoid dairy or sunlight? Do you take steroid pill, proton pump inhibitor for gastric problem? Do you smoke? Do you have a parent who broke a hip after a simple fall? Are you 50 years and old and more? If yes, you need a bone checkup. And
I'll
today we have
repeat
an
this
offer.
once again, doctor, on your behalf. So anyone who is here or who have people knowing this, avoiding milk or sunlight, we are generally mostly indoors. So you can take a self risk options from your screen. You can just take a picture of this. Anyone wants to know when is the right time we should go and meet Dr. Loy or any other orthopedician, if you are not taking regular dairy products due to any reasons, if you are mostly indoors, your vitamin D's are low, or not taking enough sunlight, you have taken any kind of steroids, hormonal issues, and you're on any kind of stomach medication like pantoprazole or similar like that omeprazole. Mostly people know about all these medicines, or initially you were taking ranitidines as well, and you smoke, you're more than 50, you have history of parent where they have fall down and they had history of risk fracture, and you have not done any recent checkup, you have not met orthopedic doctor because you don't feel a bone pain, this is the right time to see a doctor and find out if you are at risk of osteoporosis or do you need a DEXA scan and what medications will best suit for you. Maybe you can write in the comment box how many are with yes and with no or with maybe. We can proceed to the last slide, doctor, and then we can take a lot of
Before that,
questions already. Yes, doctor, please.
I just say that osteoporosis is a preventable disease. We can prevent it. We can have a good diet, take exercise when we are before 50, even after 50, continue on our exercise, and we have to do DEXA. If we find that we have osteoporosis, we can treat it by medication before the fracture happens. So don't be afraid from osteoporosis. We have to find if we have osteoporosis or not, so that we can treat it. We can prevent the complication of osteoporosis, so that you will have a good quality of life for your age.
Why we have chosen this topic was, I would like to tell the audience that the osteoporosis is generally talked much in October, but because of the slots were not available and doctors' availability, and he's a professor, he's a very senior consultant, so he wanted to do a public awareness, and it was very important for all of you to understand because this topic, most of the people don't understand the importance because this is preventable and you can really take care of it, and mostly out of 100, 70 will go into osteoporosis. And do not forget what doctor said earlier is 3 second, every 3 second fractures are happening, so at least you can bring a change. We talked a lot about diabetes, high blood pressure, cholesterol and other diseases, but this is something good for you. You can be completely mobile, and we know that we would like to be mobile till we are, and we would like our parents also to be mobile, and fracture is not something good to happen, and overall strong bones will definitely make a difference and catch this towards the later part of your life.
So please don't hesitate to do DEXA. It is simple,
Okay.
easy, and available in Prime.
Yes.
Okay. So the key takeaway: osteoporosis, a worldwide pandemic that needs more attention from all the clinicians. It is the silent death or the silent disease. Prevention of osteoporosis by a healthy diet, calcium, vitamin D intake, exercise, and bone screening is needed to prevent osteoporosis related to fracture. Osteoporosis is significantly underrated after a tardive fracture. As we said, if we patient have a fracture and we treat the fracture, we fix the fracture, and we don't treat osteoporosis, he is more liable to have another fracture after a few months. So we have to diagnose and treat osteoporosis. Poor management of refractive fracture, not only by fixation of the fracture, but we need to prescribe osteoporosis medication with the need for a proper checkup of the patient to manage osteoporosis. We need to choose the right medication for the right patient with the right sequential for the right duration. The most important is the patient should continue on his medication. Once you start medication for osteoporosis, you have to continue on it to prevent the risk of a fracture. And in postmenopausal women and men with fragility fracture, treatment with anabolic medication was associated with a significant reduction in the incidence of further fractures. Thank you.
Thank you, John. Over to you. A lot of questions. We can, if doctor has spoken most about it, doctor, we can make short answers. They can always reach back to you in the clinic because we have a lot of questions already in the lobby. Okay, over to you,
Okay.
Joanna.
Okay, thank you so much, Dr. Luay and Dr. Asia, for this great presentation and for sharing your knowledge and expertise in this topic. So now let's move on to our question and answer. I'll read first the question from Miss Jamie. The question is why women has a higher risk to have osteoporosis than men when me is moving more than women in terms of physical activities. When men is moving more than women in terms of physical activities.
Sorry, just I said that it is hormonal related. The estrogen hormone decrease after menopause, and this decrease in estrogen are increased bone destruction, the osteoclast, the destructor bony cells will act more, and when they act more, they will become to weaker bone, and the bone is liable for fracture. The
Oh,
testosterone hormone have less effect than this. So the problem is the hormone, the estrogen hormone.
uh,
For this, it is postmenopausal, usually osteoporosis in postmenopausal women.
okay, doctor. Thank you for that explanation. Moving on to the next question from Mr. Anil Chander. Are there any sides of DEXA scan? What exactly the DEXA scan is? And also, can you suggest a good vegetarian diet to avoid or treat osteoporosis?
Sorry, what about DEXA scan?
Yeah, his question is what exactly DEXA scan is, and are there any side effects of DEXA scan? Or, or again, if you could suggest a good vegetarian diet to avoid or treat osteoporosis.
Yes, DEXA scan give us an idea about it. As we said, from the numbers, we can know the bone is weak, is normal, strong, weak, or severe weakness. We call osteoporosis. So but when we know the level of our bone, we can choose the proper treatment. If we have a weak bone, we can only take calcium and vitamin D. If we have an osteoporotic bone, we have to take medication. But with all of these sequence, we have to have a good diet, a healthy diet, and a good exercise. Whatever the age, exercise is important. We have a lot of another method for diagnosis of osteoporosis. Now we have CT scan. In the future, there'll be something called bone markers. Maybe in the future, you go to the lab, take a blood test, and then you know that you are osteoporosis or not. But these are the futures. Now we have DEXA scan, CT scan also can diagnose, MRI can diagnose, but DEXA scan is simple, reliable method. And with the new programs add to the DEXA, it increases the accuracy of the results.
Okay, doctor, thank you for your detailed explanation. Now let's move on to another question from Mr. Richard. I am 70 years old and regular with gym and walk, doing my weight exercise to increase off my muscles. Some years back, I had severe crackling pain on my left knee.
Yes.
How vitamin D affects bone and its density?
Vitamin D is important because it takes calcium from the blood, put it in the bone, and the calcium is important for the strength of the bone. So calcium and vitamin D are very important. With, of course, uh, for the knee, and also he need, in addition to this medication, he need to continue on his exercise. But he can check DEXA scan for a better screening.
Thank you, doctor. Another question from Miss Salma. How and when should we diagnose for osteoporosis, or should we do some test and when to do it to prevent osteoporosis?
When you are a postmenopausal woman, you have to do DEXA scan. If the result is okay, normal, no, or osteopenia, you can diagnose usually to become osteopenia. We can increase our calcium and vitamin D level. So we have to always to check calcium and vitamin D level also for our health. And when it is normal, we can repeat it after 2 weeks, 2 weeks or 3 weeks, 2 months. Sorry. When it is normal, you can repeat it after 2 years or 3 years. But when there is a suspicious or osteopenia, we can repeat it every 1 year. In addition to calcium and vitamin D checkup.
Okay, doctor, thank you for that information. Another question from Mr. Richard. What are the symptoms in healthy person to know if he has a fracture? Does a normal person who is healthy at 70 need to do screen for bone density, and how often should I carry out such tests?
It is advisable to do the bone density in men also over 65 years of age, 60, 65 years of age, to check their bone, in addition to, as you said, calcium and vitamin D level. So it is advisable to do DEXA. Yes.
O- Okay, doctor, thank you. The next question again is from Miss Jamie. When is the right time to consult a doctor for a vitamin D for bone strengthening, even if you don't feel any symptoms of having osteoporosis? Does this variation of bone a process of aging, or can people have a normal bone till he aged?
First, vitamin D should check at any age. Calcium and vitamin D need to check at any age, because here is a problem. Although we are in a sunny area, hot area, most of the people have low vitamin D. And vitamin D not only important for the bone, it's also important for the muscle, for a lot of things. Vitamin D effect. So we have all the time to check calcium, vitamin D, whatever the age is. But when we are after menopause, we have to do DEXA. But always, all the time, we have to check calcium and vitamin D.
We still have a lot of questions in the queue. Some of it were already answered by the doctor earlier. So maybe we can just pick 2 to 3 more questions to be answered by Dr. Luai. So let me just check. Okay, again from Mr. Richard, does posture, IT jobs, or sitting all the time for drivers, chance of fracture is greater than an active person who is moving all the time? How do you take offer shown here? What booking the appointment? I'll call you back later, Mr. Richard. Okay. So, doctor, regarding the posture question of Mr. Richard.
The posture is important for our back. Of course, we need a good posture so that it will not have not only the problem of osteoporosis, osteoarthritis, and a lot of complications. So a good posture is needed. But the posture did not give us indication about osteoporosis unless we have uh, when unless the bone become weak. As we tell you, in old ladies, they become shorter and they come more bending forward because of osteoporosis-related fracture. So in this case, it will help us to have an idea about osteoporosis. But posture in general is important for a lot of disease, not only osteoporosis only. Good posture is needed for your back, back strength and for normal healthy life.
Okay, thank you, doctor, for that. Then we will have the last question, not from Miss Jamie, but from Mr. Jaime. Sorry, Mr. Jaime. So, how to avail free consultation and discount for DEXA scan? We'll have a free raffle draw later. Raffle draw, yeah. And then, what is the possibility that I can develop osteoporosis as I am taking medication for more than 20 years now for my angioplasty, aspirin, Lipitor, and Edarcbicor?
How much your age?
How old are you, Mr. Jaime? 65. He is 65.
She or he?
He.
He. Okay. 65, although he took this medication, he needs to check for osteoporosis. Just simple test, he can do it and check if he has osteopenia, osteoporosis. But 65, he need to do this DEXA. And the medication of osteoporosis, there is a lot of medication. I'm sure that if patient have osteoporosis, we can choose the proper medication for the patient because there is a lot of choices.
I would like to just add here in the earlier slide where doctor has shown people who are on proton pump like stomach medications. There are recent studies which shows that the bone formation is very less because it definitely blocks certain things in the stomach. It reduces the acidic reflux and it reduces a lot of other systems, and that deprived us for very good bone formation. So people who are on stomach medication for more than 2 years, the chances of osteoporosis is also higher. So just wanted to tell people that it's not only about cholesterol. Check for your stomach medications. Don't keep it a habit. Change your lifestyle. If you're taking for more than 2 years, you may be at risk earlier.
And also, doctor, another medication, prednisolone. If we take 5 milligram prednisolone for more than 3 months, you are liable for osteoporosis. So people who are on steroid for a long time also have to check, even they are young, they have to check for osteoporosis.
Okay, all right. Thank you again so much, Dr. Asiya and Dr. Luwai, for sharing your knowledge and expertise. We truly appreciate your time and effort you have given today. And thank you as well to everyone who have stayed with us throughout the session. We hope that you have found the information helpful and it inspires you to take simple steps towards better bone health. So now we have come to our end of our Q&A. We're ready to move on to our raffle draw. So, Mr. Khalil, now we're moving on to our raffle draw.
So this, what do you mean by raffle draw, Jonna? If you can explain to everyone.
Okay, so for the raffle draw, we each winner will receive a free consultation with Dr. Luwai Taponi at the King Faisal branch. So with 50% off on DEXA scan if recommended by Dr. Luwai, and the voucher is valid until December 15. And this voucher is transferable to any UAE resident. So let us begin our raffle draw.
Yes, Miss Joanna, I need 1 minute, please.
All right.
We apologize for not taking some last minute questions because we have already exceeded the time, but we'll ensure that we'll share the recording with all of you through your emails. And in case you have any questions, feel free to write back to us. Feel free to connect with us. We are here to increase the awareness. We are here to give you the timely information and about the diseases which are not much talked about, but which really is important for general health and well-being. And do you have any preferences for the next topic? Do let us know in the comment box which you would really like to know. And you still are not very clear about those things. We will bring a panelist specialist with all the clear information which you need to know in our upcoming webinars. And thank you for being so attentive. Thank you for joining these sessions. Without you, of course, the success is not possible. And you can always suggest the topics you would want us to present to you way forward. Please do mention in the comments, and do tell us also how do you find our webinars interesting, informative, different, or we need to improve. Feel free to give us your feedbacks as well. Christine. Okay. Do we have Christine here available? Yeah. We have 5 minutes, Khalil, Mr. Khalil. Jonah, you can take names and you can reconfirm also in the chat box. Miss Christine is here. Oh, no, I cannot be a part of this. You have to take someone else. But thank you for popping up my name, though I may need DEXA as well. But okay, we had Dr. Jagdish as a winner. Very good. Congratulations, Dr. Jagdish. And this is really interesting. Dr. Loy cannot be treating himself, so we need one more. This is interesting. Very deserving one. Congratulations, Miss Arabi. And I hope with the questions you had, you should meet doctor and you should go for DEXA itself. Congratulations, Anthony. Congratulations, Martis. And Lala. Congratulations to all of you. Over to you, Joanna, again. For a group picture, probably. Joanna, you're on mute if you're talking.
Congratulations, everyone. So now we'll move along to our group picture. We can open our cameras to take the photo.
I think they don't have the access. We have to provide them the access. Mr. Khalil, can you just help us with that? Is there any problem, Joanna?
No problem, doctor. We're just
Okay.
waiting.
Okay. Nice. Thank you, and Sister Annie. Thank you, RB. Mr.
Thank you
Anil,
all.
Ms. Jamie.
Thank you. Thank you.
Thank you.